Morning, lovely people of Stenning and Upper Beeding. Dr. Huxley here, formerly Dr. Galloway. I am on call today and I need your help because I am close to losing the plot. If you have symptoms of COVID, certainly if you have had a cough or a temperature or have lost your sense of smell or taste or it's been altered, you should get a PCR test. A lateral flow test is not enough. It does not rule out COVID if you have symptoms. A lateral flow test is purely for screening for people that don't have any symptoms, who want to just make sure they're not in the early stages, or one of those lucky people who get no symptoms when they have COVID infection. It is not a diagnostic test. You may test positive if you have COVID with a lateral flow, but sometimes you don't. You need a PCR test. This can be booked through the NHS website. There are testing centres all around the county. You need to book fairly early in the day because they do run out of spaces and most stop around 3 p.m, although there is a late one in Plumpton, I think. And they take about 24 to 48 hours to come back. You can also get postal tests. They arrive in the post the next day and then you post them off and you have to put them in a priority post box. They then take about 2 to 3 days to come back. This whole time you need to isolate. COVID is rife at the moment. Our levels are going up. I have spoken to about 4 or 5 people so far on triage at 9 a.m, all of whom who have had COVID symptoms. It's not just the classic 3 cough, temperature, smell symptoms either. Increasingly, people are starting with a sore throat or a headache or even just extreme tiredness and muscle aches. I had COVID a couple of weeks ago. It was awful. I'm double jabbed. I haven't yet managed to have my triple jab, my booster. Our whole family had it. Teenagers, they were all fine. They were a bit tired, a bit achy, generally no symptoms. Adults, we were really unwell. And actually, at no point did we have a cough. COVID is no joke. I know we're all sick of it. We are all fed up to the back teeth of this disease. But we are never going to get through this if people don't start testing and isolate and wear masks. Please don't rely on a lateral flow test if you have any symptoms, okay? Certainly, if you've been in contact with someone, you should get tested. Advice appears to change daily as to whether that should be a lateral flow or PCR. Personally, I would get a PCR because lateral flow tests are rubbish and just a waste of plastic. Stay safe, please stay healthy, please be sensible. There is a lot of coughs and colds around at the moment. We've not been unwell for 18 months. All the viruses are now circulating and we are getting coughs and colds and they are lasting longer. It is normal for a cough and cold though to last about 5 to 6 days. And if you've had a negative lateral flow and negative PCR, there's not much you can do other than paracetamol, fluids, cough and cold remedies and staying in bed. Take care.